Question 1. Which level of precautions is appropriate for a patient with AIDS who has acquired Girovetti pneumonia? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Standard precautions. Correct answer. A. Airborne precautions. Girovetti. Pneumonia is caused by pneumocystis girovetti, which is not typically transmitted through the air. However, in the case of pneumocystis girovetti, the infection can sometimes be spread through airborne particles in a hospital setting. Therefore, airborne precautions are recommended, especially in a healthcare setting when the patient might be immunocompromised, like in the case of AIDS. Question 2. A nurse is caring for a confused patient with an IV catheter. The patient frequently tugs at the IV tubing with their left hand, nearly dislodging it. What is the most appropriate intervention to ensure the patient's safety while using the least restrictive restraint? A. Apply 2-point restraints on the arms only. B. Use 4-point restraints for maximum safety. C. Apply a safety mitt to the left hand. D. Apply safety mitts to both hands. Correct answer. C. Apply a safety mitt to the left hand. The patient is using their left hand to tug at the IV tubing, which risks dislodging the IV catheter. Applying a safety mitt to the left hand will effectively prevent the patient from causing harm to the catheter without overly restricting their movement. This method adheres to the principle of using the least restrictive restraint to maintain the patient's safety and dignity. Question 3. The nurse is implementing the prescribed transmission-based precautions for a pediatric patient. Which of the following actions indicates the nurse is correctly following these precautions? A. Assigning the child to a semi-private room. B. Placing a supply of clean masks in the child's room. C. Sending specimens to the laboratory in a zip closure biohazard bag. D. Wiping the thermometer with alcohol after every use. Correct answer. C. Sending specimens to the laboratory in a zip closure biohazard bag. The patient is using their left hand to tug at the IV tubing, which risks dislodging the IV catheter. Applying a safety mitt to the left hand will effectively prevent the patient from causing harm to the catheter without overly restricting their movement. This method adheres to the principle of using the least restrictive restraint to maintain the patient's safety and dignity. Question 4. The nurse is educating adult patients about safety and injury prevention. Which of the following statements is incorrect? A. Taking a gun safety class and following its guidelines reduces the chances of injury. B. Use condoms when practicing birth control. C. Wearing a safety belt while driving or riding in a car prevents injury in the event of an accident. D. Wiping the thermometer with alcohol after every use. Correct answer. C. Wearing a safety belt while driving or riding in a car prevents injury in the event of an accident. While using condoms is important for preventing sexually transmitted infections and can be a form of birth control, it is not directly related to safety and injury prevention in the context of the other options. Question 5. A patient on neutropenic precautions inquires about how to avoid infection. Which of the following pieces of advice would be the most appropriate? A. Do not allow visitors within 10 feet. B. Brush teeth only once a day or every other day. C. Use only pads during menstrual periods. D. Wash hands after cleaning up after pets. Correct answer. D. Wash hands after cleaning up after pets. Washing hands after cleaning up after pets is crucial to prevent infection, especially for a patient on neutropenic precautions. Neutropenic patients have a weakened immune system, making them highly susceptible to infections. Proper hand hygiene is essential to reduce the risk of introducing harmful pathogens. Question 6. Which of the following scenarios is not appropriate when practicing aseptic technique? A. Dispose of everything and start anew. B. Put on sterile gloves by only touching the inside of both gloves. C. Avoid touching the sterile field unless it's within 1 inch of the edges. D. Open sterile supplies or instruments away from your body to prevent contamination. Correct answer. B. Put on sterile gloves by only touching the inside of both gloves. When practicing aseptic technique, sterile gloves should be put on by touching only the outside of the gloves to maintain their sterility. The inside of the gloves should never be touched with ungloved hands, because doing so would contaminate the gloves and compromise the sterile technique. The proper way to don sterile gloves is by handling them from the inside, but not touching the inside surface directly with bare hands. Question 7. In the report, the previous nurse highlighted that one of the newly admitted patients is under seizure precautions. Which of the following actions is appropriate for the incoming nurse to take for this client? A. Apply soft limb restraints to the upper extremities. B. Relocate the client to a room nearer to the nurse's station. C. Provide the client's food in paper and plastic containers. D. Keep the client's bed in the lowest position. Correct answer. D. Keep the client's bed in the lowest position. When a patient is under seizure precautions, the primary goal is to minimize the risk of injury during a seizure. Keeping the client's bed in the lowest position is a critical safety measure because it reduces the chance of the patient falling out of bed during a seizure and sustaining injury. It ensures that if a seizure occurs, the patient will be closer to the ground, reducing the risk of harm from a fall. Question 8. Which observation after ECT treatment would raise the most concern for the nurse caring for the client? A. The client complains of backache. B. The client complains of headache. C. The client is unable to recall her name. D. The client is unable to remember what she ate for breakfast. Correct answer. C. The client is unable to recall her name. Electroconvulsive therapy commonly causes transient memory loss, particularly around the time of the procedure, such as difficulty recalling recent events. However, memory loss that affects basic personal information, such as the inability to recall one's name, is more concerning. This could indicate a more significant issue, such as prolonged or more severe cognitive impairment, which requires immediate attention. On the other hand, complaints of backache or headaches are common after ECT and are generally not as alarming. Question 9. What action should the nurse take when a physician orders ibuprofen for a patient who is allergic to NSAIDs? A. Administer the medication per the physician's order. B. Ask the patient if he or she feels comfortable taking the medication. C. Contact the physician to verify the order and discuss concerns. D. Find out how serious the patient's reaction is to NSAID exposure. Correct answer. C. Contact the physician to verify the order and discuss concerns. Ibuprofen is a nonsteroidal anti-inflammatory drug, and if the patient is allergic to NSAIDs, administering it could trigger a serious allergic reaction. The nurse must contact the physician to clarify the order and ensure patient safety. It's essential to confirm the appropriateness of the prescribed medication for the patient's condition and allergy history. Administering the medication without addressing the allergy would pose a risk to the patient. Question 10. Which of the following actions is most crucial for patient safety after a myelogram? A. Check the popliteal pulses bilaterally. B. Verify that the consent form for the procedure has been signed. C. Ensure the patient remains flat for 2 hours after the procedure. D. Perform a neurological assessment. Correct answer. D. Perform a neurological assessment. After a myelogram, a diagnostic procedure involving contrast dye and X-rays of the spine, the most crucial action is to perform a neurological assessment. This is because the procedure involves injecting contrast into the spinal canal, which carries risks of complications such as nerve injury, headaches, or seizures. Regular assessment of the patient's neurological status, e.g., level of consciousness, movement, sensation, and reflexes, is essential to detect any adverse effects early and intervene if necessary. Question 11. After administering a preoperative medication to a patient and discovering that the consent form has not been signed, what is the nurse's next step? A. Call the operating room and inform them that the surgery must be cancelled. B. Contact the physician. C. Notify the nursing supervisor. D. Transfer the patient to the operating room. Correct answer. B. Contact the physician. The nurse's responsibility is to ensure that the patient has given informed consent before any procedure, including surgery. If the consent form has not been signed, the physician must be contacted to clarify the situation and ensure that proper consent is obtained before proceeding with the surgery. Question 12. Which of the following is the least restrictive restraint that will still ensure the safety of a confused patient who is tugging at their IV catheter with their left hand? A. 2-point restraints on the arms only. B. 4-point restraints for maximum safety. C. Safety mitt for the left hand. D. Safety mitts for both hands. Correct answer. C. Safety mitt for the left hand. Safety mitts are specifically designed to prevent a patient from using their hands in a way that could cause harm, such as tugging on an IV line. By applying the mitt to only the left hand, you are targeting the behavior, tugging on the IV, without limiting the patient's ability to use their right hand or move around freely. This makes the safety mitt the least restrictive option that still addresses the immediate safety concern. Question 13. After the nurse on the surgical unit administers the preoperative medication to a client scheduled for surgery, they discover that the consent form has not been signed. What should the nurse do next? A. Contact the operating room and inform them that the surgery needs to be cancelled. B. Reach out to the physician. C. Notify the nursing supervisor. D. Take the client to the operating room. Correct answer. B. Reach out to the physician. Informed consent is a fundamental legal and ethical requirement for any surgical procedure. It ensures that the patient understands the risks, benefits, and alternatives associated with the surgery and has voluntarily agreed to proceed. Once preoperative medication is administered, the patient's cognitive ability may be impaired, making it impossible for them to provide valid consent afterward. Since obtaining informed consent is the physician's responsibility, the nurse's immediate priority should be to inform the physician of the oversight so they can take appropriate action to address it. Question 14. What is the most appropriate action for the nurse to take when caring for an older patient with a history of alcoholism who is scheduled for hip replacement surgery in 12 hours? A. Notify the physician that additional assessment is needed. B. Request a urine, BAC test from the patient before surgery. C. Inquire about the patient's last alcoholic drink. D. Provide care to the patient without considering their history. Correct answer. C. Inquire about the patient's last alcoholic drink. In patients with a history of alcoholism, it is crucial to assess their recent alcohol use, as it can significantly affect surgical outcomes and anesthesia management. Alcohol withdrawal can occur within hours after the last drink, and understanding the patient's recent consumption helps in anticipating any potential withdrawal symptoms or complications. The nurse should inquire about the last alcoholic drink to ensure proper management before surgery. Question 15. The nurse is caring for a client diagnosed with conversion reaction. The nurse identifies that the client is using which of the following defense mechanisms? A. Displacement. B. Identification. C. Introjection. D. Repression. Correct answer. D. Repression. In conversion reaction, psychological stress or conflict is unconsciously repressed and manifests as physical symptoms, such as paralysis or blindness, without a medical cause. Repression involves blocking out distressing emotions or thoughts, which is central to conversion disorder. Question 16. Which diagnosis does the nurse suspect for a 14-year-old boy who is bright, a good communicator, but has unusual social interactions and is obsessed with organizing his baseball card collection? A. ADHD. B. Asperger's syndrome. C. Rett syndrome. D. Autism spectrum disorder. Correct answer. B. Asperger's syndrome. Asperger's syndrome, a condition on the autism spectrum, is characterized by difficulties in social interactions, restricted interests, and repetitive behaviors, such as an obsession with organizing collections. The child described is bright and a good communicator, which is a common trait in individuals with Asperger's syndrome, distinguishing it from other forms of autism that may have more significant communication challenges. Question 17. A patient is admitted to the psychiatric unit following a suicide attempt. The nurse plans to create a suicide prevention contract. In order to promote adherence and build trust, who should take the lead in writing the contract? A. Written by the patient. B. Written by the physician. C. Written by the social worker. D. Written together by the nurse and patient. Correct answer. D. Written together by the nurse and patient. A suicide prevention contract is a collaborative approach that aims to involve the patient in their own care and recovery. When the nurse and patient work together to write the contract, it promotes a sense of ownership and responsibility for the patient's safety plan. This collaborative process builds trust, encourages the patient to take an active role in their recovery, and allows the nurse to ensure the contract is both realistic and tailored to the patient's needs. By involving the patient, the nurse can also assess the patient's understanding of the plan and ensure their commitment to following it. Question 18. What is the first step the nurse should focus on when providing care and collecting evidence from a victim of sexual assault? A. Collect specimens. B. Obtain consent. C. Perform a pelvic exam. D. Support the patient's emotional needs. Correct answer. D. Support the patient's emotional needs. The first priority when caring for a sexual assault victim is to address their emotional and psychological needs by offering support, ensuring safety, and providing a non-judgmental environment. Once the patient feels emotionally supported, the nurse can move forward with obtaining consent, collecting evidence, and performing medical assessments. This approach builds trust and helps the patient feel more comfortable in a difficult and distressing situation. Question 19. In which stage of separation, anxiety does a child exhibit sadness and apathy? A. Despair. B. Detachment. C. Disassociation. D. Stoicism. Correct answer. A. Despair. During the despair stage of separation anxiety, a child displays sadness, withdrawal, and apathy due to prolonged separation from their caregiver. The child may lose interest in activities and appear emotionally detached or discouraged. This stage follows the initial protest and occurs before reunification with the caregiver. Question 20. The nurse is caring for a patient diagnosed with antisocial personality disorder who has a history of fighting, cruelty to animals, and stealing. Which of the following traits is the nurse most likely to uncover? A. A low tolerance for frustration. B. Frequent expression of guilt regarding antisocial behavior. C. History of auditory hallucinations. D. History of gainful employment. Correct answer. A. A low tolerance for frustration. Patients with antisocial personality disorder typically exhibit a pattern of disregard for the rights of others, which often manifests in behaviors such as aggression, cruelty, and stealing. They tend to have a low tolerance for frustration and may react impulsively or aggressively when things do not go their way. They are less likely to express guilt about their antisocial behavior, and they do not usually experience auditory hallucinations or maintain consistent gainful employment. Question 21. A patient taking Lasix is advised to increase the intake of which of the following foods? A. Apples. B. Cantaloupe. C. Iceberg lettuce. D. Plums. Correct answer. B. Cantaloupe. Lasix, furosemide, is a diuretic used to treat high blood pressure, edema, and heart failure, but it can cause potassium loss, leading to hypokalemia. To prevent this, patients are advised to eat potassium-rich foods, with cantaloupe being a great choice due to its high potassium content. Question 22. Which medication should the nurse have available for a client who has received Versed? Diazepam, Valium. B. Florinef, fludrocortisone. C. Flumazenil, Romazicon. D. Naloxone, Narcan. Correct answer. Flumazenil, Romazicon. Versed, midazolam, is a benzodiazepine used for sedation and anxiety relief. In case of overdose or adverse effects from Versed, flumazenil, Romazicon, is the antidote that can reverse its sedative effects. Flumazenil works by blocking the benzodiazepine receptors in the brain. Question 23. A doctor prescribes alprazolam, Xanax, 0.25 milligrams orally 3 times a day for a patient experiencing anxiety and physical symptoms due to work-related stress. Which of the following common side effects should the nurse monitor for in this patient? A. Agranulocytosis. B. Bradycardia. C. Drowsiness. D. Tardive dyskinesia. Correct answer. C. Drowsiness. Alprazolam, Xanax, is a benzodiazepine commonly prescribed for anxiety and related symptoms. It works by enhancing the effects of a neurotransmitter called GABA in the brain, which helps calm nervous activity. One of the most common side effects of benzodiazepines, like alprazolam, is drowsiness, as it can cause sedation and fatigue. Question 24. Which type of fluid output is usually not measured? A. Evaporative water from the respiratory tract. B. Emesis. C. Chest tube drainage. D. Urine. Correct answer. A. Evaporative water from the respiratory tract. Evaporative water from the respiratory tract, also known as insensible water loss, occurs through normal respiration and is not typically measured in clinical settings. Insensible losses also include perspiration from the skin, and these losses are difficult to quantify accurately. Question 25. Which of the following is an appropriate step when communicating with a patient who is hard of hearing? A. Ask multiple questions in a row quickly to make sure the client is engaged. B. Divide the verbal communication into smaller sections and address one at a time. C. Communicate only with written information. D. Frequently communicate without assistive devices to help the client improve their hearing. Correct answer. B. Divide the verbal communication into smaller sections and address one at a time. Breaking verbal communication into smaller, manageable sections allows the patient to better process and understand the information being conveyed. This method helps prevent overwhelming the patient with too much information at once and allows for easier lip reading, use of hearing aids, or other assistive devices. Question 26. Which of the following is least important when assessing a client's risk for elimination impairment? A. Family history. B. Ambulation abilities. C. Current medications. D. Hydration status. Correct answer. A. Family history. Elimination issues are typically influenced by factors such as the client's current medications, hydration status, and ambulation abilities, which directly impact bowel and bladder function. Family history may have some relevance in certain conditions, but does not have as direct an effect on immediate elimination impairment compared to the other options. Question 27. How is diltiazem classified in terms of drug type? A. Calcium channel blocker. B. Beta blocker. C. ACE inhibitor. D. NSAID. Correct answer. A. Calcium channel blocker. Diltiazem is classified as a calcium channel blocker. This type of drug works by inhibiting the influx of calcium ions into the smooth muscles of the heart and blood vessels, leading to relaxation and dilation of the arteries. This helps lower blood pressure, reduce the workload on the heart, and manage conditions like angina and certain arrhythmias. Question 28. Which of the following is not a symptom of serotonin syndrome? A. Confusion. B. Edema. C. Fever. D. Tremors. Correct answer. B. Edema. Edema, swelling due to fluid accumulation, is not a typical symptom of serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition caused by excessive serotonin levels, typically due to drug interactions or overdoses of serotonergic medications. Question 29. What is the most appropriate way for an LPN to proceed after attempting to resolve a conflict with another nurse without success? A. Report the conflict to the director of nursing over the unit. B. Report the conflict to the nurse manager of the unit. C. Discuss the conflict with the other nurse to attempt resolution of issue. D. Report the conflict to the assigned charge nurse of the unit. Correct answer. D. Report the conflict to the assigned charge nurse of the unit. The charge nurse is responsible for managing team dynamics, resolving conflicts, and ensuring a smooth workflow on the unit. When an LPN is unable to resolve an issue directly with another nurse, escalating the matter to the charge nurse allows for a neutral party to intervene and mediate. The charge nurse can assess the situation, provide guidance, and implement a resolution that maintains professionalism and supports a collaborative working environment, ensuring that patient care is not compromised. Question 30. What is the most appropriate action if a nurse suspects that the attending physician performing a chest tube insertion is intoxicated? A. During the procedure, begin writing an incident report. B. Leave the room immediately so as not to be held liable for any complications. C. Report the concern to the charge nurse. D. Observe the physician while performing the procedure with extra attention to make sure no mistakes occur. Correct answer. C. Report the concern to the charge nurse. The charge nurse is responsible for addressing issues that could impact patient safety, including concerns about a physician's fitness to perform a procedure. Suspecting that a physician is intoxicated poses a serious risk to the client, as it could impair judgment and skills, leading to potentially harmful outcomes. By immediately reporting the suspicion to the charge nurse, the nurse ensures that the situation is addressed appropriately, following hospital protocols to protect the client and uphold professional standards of care.